My name is Jonathan Vigdorchik. I'm an orthopedic surgeon who specializes in hip and knee replacement at the Hospital for Special Surgery. Most people that come to my office have hip or knee osteoarthritis. The majority of these people have had pain for many years, and they're finally getting around to the point where it's bothering them or significantly affecting their quality of life. I also see patients who have had hip replacements and knee replacements done elsewhere, and they're having pain, and they want us to evaluate what's wrong with those implants. I specialize in all types of hip surgery, so when you come to see me, we can really select the procedure that's appropriate for your condition. Some people might not need a hip replacement. Other people might need a redo of their hip replacement. So we try to find what your condition is and choose the appropriate surgery for you. Whether that's an anterior approach, a posterior approach, a hip scope, a hip resurfacing, there are multiple types of hip surgeries, and we can select the right one based on your condition. My idea of a patient visit at HSS is that you come into the office, we diagnose your problem, I can send you for specialized radiology scans, whether that's X-ray or CT scans. From those scans I can create a 3D model and virtually plan your surgery before we even start, and then using a robot that can help me execute my plan in order to prevent complications. That will help me not only to be comfortable doing your surgery, because every patient's surgery is different, and allows me to really customize your experience. My goal as a surgeon is to get my patients back to the activities they want to do every day. Whether that's running around with your grandkids, walking down the beach with your wife, playing tennis, surfing, skiing, anything you want to do, I want you to go back and be able to do it. I have a folder in my office with every card that every patient has ever given me. So it's very important to me that they get back to doing the things they want to do. My office staff knows that getting hugs is one of my favorite things for my patients.